But we begin this morning with the fact that with the coming new year, Long Islanders and folks in New York City will be able to access legal medical marijuana for the first time. And joining us to talk about that are two gentlemen. They are Thomas Hopkins. He is the president and CEO of EPIC Long Island, which used to be the Epilepsy Foundation, and has long advocated for medical marijuana in New York. And also Nicholas Vita. He's the CEO for Columbia Care, which is all set to open its medical marijuana facilities both in New York City and Manhattan, and Riverhead, a first of its kind for this region. So welcome to the show, gentlemen.
Thank you.
Good morning.
Let me begin with you, Mr. Vita. So when will you open up and where?
Our plan is to open up in Manhattan first at the beginning of January. Our target date is January 5th, followed by Plattsburgh, Rochester, and then opening up in Riverhead at the end of January.
So pretty much the whole state now.
That's correct.
And then in Riverhead, you know, initially when you went to go to the facilities in Riverhead, there was opposition. Looked like it might be significant opposition. Somehow you came to terms. How did you do that?
I think the key to our success was collaboration. We were very fortunate in that we had supporters from the advocacy community, from the medical community, and ultimately from the political stakeholders that were making the decision on behalf of the Riverhead community.
Yeah, and Mr. Hopkins, EPIC Long Island, I think Nick referred to that just now. You were one of the strong advocates, right?
Yeah, we were. I think it comes down to the people that we represent, and those are people with epilepsy, families who have children with epilepsy, people who aren't able to control their seizures in any way with the medications that are available, which are basically a third of patients who have epilepsy don't get that kind of control.
And does medical marijuana help patients with epilepsy?
There has been a lot of anecdotal evidence over the years that a component of medical marijuana, CBD oil, is effective in controlling some types of seizures, especially in small children.
Well, now you see here we're rolling video. This is what people see when they think of pot, you know, rolling a joint and smoking it, or, you know, rolling it up, and people being able to do that in other states where it's legal now. That is not going to be the case here in New York. Explain why that is, Mr. Vita.
Well, New York took a very, very precise approach to their program. What you're seeing on the footage right now is not allowed in New York in any way, shape, or form. What we do is we produce extracted product from the plant that's purified and tested.
Do you think smoking it in smokable form should have been allowed?
Our view is that the regulations were written as best as they could be, and we support it. The fact is that the ability to test, validate, purify, and create a consistent manufacturing process gives a lot of confidence to patients and physicians as they think about moving into a new arm of healthcare.
Does that concern you at all, Mr. Hopkins? Some critics have said that you get better benefits when it is in smokable form.
I haven't heard that. I haven't heard that. I know that for people with epilepsy and what's been established to date, all the research is still very preliminary. Not a lot has been done. But really, the benefit that people with epilepsy get from medical marijuana is a specific component called CBD oil. Now, marijuana has over 100 different chemical components in it. There are two that are neurologically significant. One is the THC, which is also psychoactive, so that's the thing that gives you the high. And then there's the CBD oil, which seems to have a calming, anti-inflammatory effect on the body. So it's good possibly not just for epilepsy, but for many other medical conditions.
What other conditions are we talking about?
Well, in New York, they have a list of qualifying conditions, HIV, cancer. There are a number of conditions that have been used off-label, if you will, for many, many years outside of a regulated framework.
And so how will it be delivered to the patients then?
So the primary point of access will be through the dispensaries themselves.
And, I mean, how do they receive it? In what form? Is it a pill? I mean, how do they get, is it an injection? How do they receive the oil you were talking about?
The state has prescribed exactly how we can produce, manufacture, and package the product, but at first we're using an oral tincture, a concentrate that can be vaporized, so it can be inhaled, and then pill form.
Do you think there's going to be opposition to this as folks see how it unveils? Because, you know, there's already been a few towns that have said proactively that they don't want it cited there.
If I can answer this one, we were talking about this as we were waiting,
right.
and we think that just the opposite will happen. As things unroll, as things unveil, there'll be less opposition. Because I think right now, for a lot of communities, they're dealing with something brand new. They don't know what this entity is, this distribution center, this dispensary. And so when a local municipality is trying to make a decision about whether this is good or bad for the community, they try and put it in a category that they know. But we would say this type of dispensary is closer to a pharmacy or a healthcare store or a convenience store.
So is marijuana medicine then in your mind?
Marijuana is a medicine.
It is a medicine.
Has it been classified as such now?
It has not yet, but that's because the scientific evidence hasn't been proven. If I could just echo one thing that Tom just said, you know, the fact of the matter is that having that healthy dialogue is very important. This is new for every community, and I think understanding how New York approached this and how communities can have their questions answered through a real dialogue is really critical.
Is there a model that you're basing it on that's been practiced anywhere else?
We have operations in other states, Massachusetts, Washington, D.C., Arizona, all of which are medically focused, as is Illinois. And I think that the model that we're following is really a very highly regulated, medically focused model that we would embrace everywhere.
Well, you know, we'll see what the reaction is, and, you know, it's new territory for everybody, so perhaps you're going to be right, but you also know that you will hear from people that are saying this already, that this is the first step towards legal pot in New York. Do you view it that way?
From our perspective, we have a medical mission. We don't get involved in any markets where there is a recreational program. We have no interest in it. We've made the commitment, in fact, to Riverhead that we will never sell recreational marijuana out of our facility, and we stand by that commitment. We made the same commitment in Boston, and we make that same commitment in any community to make sure they understand exactly where we are.
So we're seeing this divide in how the medical marijuana is being delivered now across the country, and you're taking that approach.
That's right.
Well, again, so it opens when? Just and if people feel that they can benefit from this, what are they supposed to do? Deal with their doctor?
The first thing they do is go to their doctor. Doctors have to go through a certification process. They're qualified, and then they can approach the state. And once they're actually certified by the state, they can come into our facility, and we can help them through the process.
Well, it's a whole new world that some people thought we'd never see, but here it's coming in, with 2016 medical marijuana on Long Island and in New York City, soon to open near you. Tom's Hopkins with Epic Long Island, Nick Vita with Columbia Care Medical Dispensary in Riverhead. Thank you for stopping in today.
Thank you.
Thank you.